are still working on the treatment of the cervical spine. So we started with joint mobilizations, and then I showed you some self joint mobilizations using a strap to do at home. And then we talked about self-nerve glides, okay? What I'm not making videos of because they're in your PowerPoint presentation and I feel like it's really self-explanatory, but doing some self-soft tissue work with a Theracane or a stick of some sort, or using lacrosse balls, and then doing stretches, like a stretch for the upper trap or stretches for levator, finding a corner and doing pec stretches with different variations. I feel like you guys can look at those pictures and figure that stuff out. So after all of that, so we have improved joint mobility, we have worked on soft tissue mobility, so we've done treatments with our hands to help the joints move better. What comes next? Okay, so you've improved the mobility of your patient's joints. Now we have to teach the muscles that stabilize those joints, and here we're talking specifically about the cervical spine. We have to make sure that the stabilizing muscles are firing and doing their job. Now, we have done an assessment of those muscles when we did muscle testing for the cervical spine, and then we also pulled out our stabilizer and did very specific physical performance measure testing using this of the deep neck flexor. So we're talking about longus colli and longus capitis, okay? So let's say we did that and we found, remember we went through the whole thing where we inflated it up to 20, and then we had the patient do a chin tuck, increase it to 22, hold it for 10 seconds, and then go back to 20, and then go to 24, and so forth, all the way up to the 30 mark on your little dial here, okay? So let's say Mr. Julian failed miserably, and I know that we need to come back and do some treatment with him, okay? So one way that I might help him understand how to do the chin tuck and the retraction to activate his muscles is through pulling this thing back out again, this stabilizer cuff or pressure biofeedback, to do some very specific training of longus colli and capitis, okay? And then teach him how he can progress exercises at home. Now, at this point, you've listened to the entirety of my PowerPoint lecture, and so you know that from a conceptual standpoint, we're talking about creating stability at the core, so that we can have movement of our extremities and movement of our body while these deep stabilizing muscles are doing their job at a very, very local level to help protect the discs and the facet joints against shearing forces, okay? So again, that idea of proximal stability for distal mobility, okay? So here we're going to be working on the proximal stability, and once he gets it, we're going to start moving limbs, okay, to see if he can still stay stable with his local muscles, okay? I'm just going to show you this here in a supine position or a hook lying position, okay, as part of your activities for after you've listened to the lecture and watched these videos. For your activities tomorrow morning are going to involve taking this beyond a hook lying position, and what next position would you put him in, and how would you progress your patient to increase the demand on the stabilizers. Sorry, I didn't mean to stick my thumb in your ear. That's kind of fun. To further challenge his system, okay? A lot of variety and creativity, but I just want to teach you conceptually the basics. Stop. Okay. These boys have been quarantined for way too long. Even the dog is passed out here.
Yeah, he's had enough.
Yeah, okay. Let's do this. Now, so what we're going to do is I'm going to take this pressure cuff. So Julian, you're familiar with this pressure cuff, right?
Quite so.
Oops. Okay, so let's put this underneath your neck. There you go. So you put it underneath their cervical lordosis, and I'm going to pump it up to about 20. Okay? Okay. Now, you're going to hold that. It's not the dial that you need to watch.
Okay, so
okay?
stick with his neck.
So make sure it's at 20. Okay? So make sure it's at the 20. Good.
All right.
So the initial part of this training is just going to be going back through what I used as a test. Now we're going to use it as a treatment. So Julian, I want you, so you see you're starting at the 20. I want you to do a little bit of a chin tuck, and I want you to only increase it so that it goes from the 20 to the 22. And then I want you to hold it there for 10 seconds. Okay, and then he would release it. He'd hang out at 20 for 10 seconds. And now you're going to do a chin tuck again and go up to the 24. And you're going to hold that. Okay, so that's the sequence. So eventually he'd go from the 24 back to 20, then he'd go to 26. Let's say now he's able to hold it at the 30, which he is able to do. You're going to hold it at 30. Okay, and now what I want you to do, I want you to lift your right knee and lift it up like you're marching. But don't let this dial move. Don't let it change. Good. And then back down. Yeah, see now the needle's moving around a little bit. So then alternate sides. Okay. Good. So he's able to do that. So I might have him do maybe 10 on each side. He's trying to keep that needle at the 30 millimeters of mercury on my pressure gauge.
It's not.
Huh?
It's not staying.
It's hard to do, isn't it? So here he's working on his, so it just shows you he's doing something with his leg, and it makes it harder for him to maintain contraction of those deep neck flexors. Okay? Now, let me hold this. So I'm watching the dial. I'm going to hold it for you. Yes, that's right. You got to fix your pretty hair.
It's beautiful.
Okay?
Please, princess.
Okay? So we're going to start it at the 20. Now, put your arms down by your side. Okay? You see the dial?
No.
I'm going to keep it here. You see it?
Sideways.
You can see that it's a 20.
I'm dyslexic.
Stop.
Dummy.
Guys. Okay. Now, keep it at the, I want you to increase it to 30. Stay there. And now I want you to lift your left arm up to about 90 degrees. Good.
Oh my god, that's 40.
Good. And then back down. Keep it at the 30. And then you're going to alternate arms. Okay. I might have him do that 10 times. Okay. I could change it and say turn your thumbs out to the side. Go back down. Turn your thumbs out. Rotate your arms out. And now, instead of coming up this way, go out to the sides and up.
Oh wow, that's hard.
Yep. Good. I'll probably keep him below 90 degrees until he's a pro at this. And he can do this. I could have him bring him all the way up overhead. Okay.
That was good.
Okay. You could flex your elbows. So I could bring him out here and have him do internal. Oops. That should have come from you fixing your neck, not me pumping this up. Silly. Okay.
Silly goose.
Stupid.
See you. So now I want you to do this on both sides.
Whoa.
Internal, extra. Nope, not this way.
What?
This way.
Oh, I don't have that range of motion.
Yes, you do.
Oh, okay, I do.
Keep it at
I'll
the
let you
30,
Cool.
and then back.
Rotate
Okay.
your cuffs are not bueno.
Okay. Okay, good. So, now, not all of your patients are going to have this pressure cuff at home, and that's okay. If they happen to have a blood pressure cuff, they could use a blood pressure cuff to do the same. You can teach them to do that. You know, or really, if you teach them, if this is something that you're doing a lot with your patients, which if you're treating neck patients, you should probably invest in one of these. They're like $40, I think. Or use your blood pressure cuff in the clinic, and then once your patient understands what, you know, they've watched it on the dial, okay, I know kind of what it feels like to do that 30 millimeters of mercury on the dial, then they can extrapolate that to what they're doing at home. So you start them by lying on their back, doing a chin tuck, and then you have them start doing motions with their upper extremities, and their job is to make sure that they're maintaining that chin tuck position. You're also, again, watching to make sure they're not compensating. So you teach them to palpate their SCMs and their upper traps to make sure that those muscles stay relaxed. when they're doing these arm movements. Okay, I don't care what they do with their arms. It doesn't matter. The point is that by moving arms against gravity and in different directions, you're making it harder to keep that neutral neck position and to keep those deep neck flexors contracted. So you're increasing the challenge to the system. Okay, so you can come up with whatever crazy moves you want. Okay, as long as it's challenging their system, and then you can take them into different positions. So here he's fully supported by the table. What position might you try next? Okay, and what kind of exercise progressions do you think you could do to help progressively make it harder for him to stabilize with his deep neck flexors? Okay, so that's going to be for your activity. The next thing I want you to do, Julian, is turn on your stomach. So now we're going to work the deep neck extensors, in particular the little tip and eye. Although our deep neck flexors are also going to be working because he's going to need to be holding the chin tuck position. Nope, we're not going in the hole.
What?
Actually, I'm going to stay. Forehead here. Arms down by your side. Now what I want you to do, okay, is I want you to do a chin tuck. Okay, so he's having to do a chin tuck against gravity, palpating his muscles back here in the posterior part of his neck. And now what I want you to do, okay, is lift your arm up off the table. Just do one at a time. And then back down. And then the other. Now, what I'm also watching for is I don't want him to start lifting through his upper trunk here, okay? So, other than you lifting your arm up into some extension, I shouldn't see your upper back really trying to help here. This needs to there you go, come from here. So you're holding the chin tuck. Good. And back down. Keep on going. Just make sure I'm not forgetting something here. Computer shut off.
No.
The table doesn't taste good.
Your nose is so squished.
Nose. Voldemort.
Okay, now, so that's one thing you can do. Guys, we're almost at the end of this video, don't ruin it.
I'm gonna ruin it.
Now bring your arms up overhead. Okay, so now what we're gonna do, okay, is you're gonna do, just put your head down, chin tuck position. Call this the Superman. He's gonna lift his arm up, just one at a time.
Okay.
One at a time.
Okay.
Dun, dun,
he
dun.
Stop.
That's Superman.
Okay, lower trapezius. Yes, we are working our lower trapezius. But again, that isn't the goal of our exercise here. The goal is, can he do that without losing this position of his neck? And he cannot. So this is way too hard for him.
I'm bad.
You are not bad. Okay. So for him, would go back. I would not even go above head. I would come back to here and start him in that position. Okay? Instead of coming overhead, why don't you put your arms down here by your side and lift down this way. And do this. Turn your thumb up though. There you go. Okay? So this will be the motion, this horizontal abduction, one at a time. Okay? Again, the focus is here. Okay? If it ends up being too hard for him to do this because he's got scapular issues, then that needs to be worked on separately. Okay? Okay.
Am I doing it?
Yep, and I do the other side. You keeping the chin tucked in?
Yeah.
Okay. All right. So you're also watching as you have him do these things, like, okay, you know, is he having trouble lifting his arm because he's weak through here? Then does that need to be addressed as part of his upper quadrant dysfunction? Absolutely.
It does.
Okay. All right, so you guys are going to play with this in your activity and come up with lots of variations and exercise progressions that challenge the deep neck flexors and the deep neck extensors. Okay?